Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to my YouTube channel. Today our topic of discussion is maxillary central incisor. We are going to discuss the intro, morphology, clinical consideration, aesthetic importance, clinical significance of maxillary central incisors. First of all, we should know about maxillary central incisors. Maxillary central incisors are four front teeth located in the upper jaw. We are going to discuss about the tooth located in the upper jaw between or midline. It is the first tooth from the midline, and so is the tooth with the most prominent effect on the person's smile, which means that they are related to our aesthetics. Tooth number of maxillary incisor in universal system is 8 and number 9. Now we come towards the key characteristics of maxillary incisors. They are located bilaterally on our upper jaw, which means that one on each side of the midline. They are the largest of the anterior teeth, having blade-like shape and are designed for cutting food during mastication. They are responsible for biting, cutting, and speech. Development table explains the stages of development of maxillary incisors during different ages. The first stage is initiation of calcification, which occurs during 3 to 4 months. Number 2 is completion of enamel, which occurs during 4 to 5 years. Number 3 is eruption, which occurs at 7 to 8 years, and number 4 is completion of roots, which occurs during 10 years. Morphology of maxillary incisor is stated under 5 aspects. Number 1 is labial, number 2 is lingual, mesial, distal, and the last one is incisal. Here is a picture which shows different stages of maxillary incisor. Let's start with the first aspect, which is labial aspect, which explains the front view, which means that the side of the tooth which is towards the lips. The outline from the crown is trapezoidal with the wider at the incisal edge. Maxillary central incisor ends at two angles, the sharp mesio-incisal angle and the round disto-incisal angle. Labial surface is smooth with slight convexity with developmental loops, which are mesial and distal loops. Cervical line curves apically. Lingual aspect is the second aspect, which means that back view or palatal view. The palatal surface is trapezoidal and is narrower than the labial surface. A large convexity called cingulum is present in the cervical third. Mesial and distal marginal ridges are present. Lingual fossa is present in the center, which vary in depth. Occasionally, a lingual pit is present near the cingulum. The diagram explains all now these coming points. To the proximal aspect, the mesial aspect, which means that the side view of the teeth. The crown is triangular or wedge-shaped with its base at the cervix. The incisal edge lies at the midline axis of the tooth. The CEJ, which means that cervix enamel junction, shows a significant curvature toward the incisal edge more than distal. Root tapers toward the apex and is conical with a blunt end. Look at the picture which shows all the above points which I have explained before. Coming to the other proximal aspect, the distal aspect, it is exactly same as that of the mesial aspect but with less curvature of the CAJ. Its contact point is higher, which means that more cervical than the mesial contact. It is slightly more rounded in contour as compared to the mesial aspect. Lastly, the incisal aspect, which means that the top view of the tooth. As with all the teeth, no part of the root is visible from the incisal aspect. Crown is roughly triangular or maybe shovel shaped. Labial surface appears broad and slightly convex. Lingual surface is narrower and singular is visible. Incisal edge is straight with curve. The mesiodistal dimension is greater than the labiolingual dimension. Here we look on the clinical considerations regarding maxillary central incisors. They are site for trauma, commonly in children, central in smile design and restorations, prone to caries in the lingual fossa, used in orthodontics and prosthodontics. Maxillary incisors are crucial for our aesthetic importance, which means that they play a major role in our aesthetics of the smile and our facial appearance. Clinical significance of maxillary central incisors are that they are important in biting and chewing. They really affect our speech and pronunciation. It also impacts self-esteem and confidence. We have concluded that maxillary central incisors are important both for their function and aesthetics. Their anatomy are important for dental professionals to understand. That's all about maxillary central incisor. If you have any query regarding this discussion, do ask me in the comments. Thanks for watching my video. Allah Hafiz.